Welcome to the Pain and Inflammation video series. I'm Terry Shockley, Vice President of Sales for Anabolic Laboratories. We've been providing quality nutritional products for over 85 years. I hope you find these videos helpful, and we look forward to doing business with you. I'm joined today by Dr. David Seaman and Dr. Russ Antico. Gentlemen, welcome and thanks for being here.
Thank you. Good to be here.
Our topic today is natural pain relief using white willow bark, the primary ingredient in Anabolic's all-natural product, Salizain. Let's start with you, Dr. Seaman. You're the guy that came up with the formulation. What guided your choices, and how does white willow bark work?
I was led by the guidelines that were put forth by the American Pain Society and the American College of Physicians. And they compared various pain relievers, and it turned out that they rated equally white willow with NSAIDs, with acetaminophen, and with muscle relaxants. And the dose that they recommended was 240 milligrams of Salizain, which is a component of white willow. To get 240 milligrams, you have to get about 970 to 1,000 milligrams of white willow extract. So there's an additional 700 milligrams in the supplement, and that additional 700 milligrams are unique white willow phytochemicals that work synergistically with the Salizain to produce a general and better analgesic anti-inflammatory effect.
So I think what people would really want to know is, how does Salizain or white willow bark compare to other pain relievers?
Well, there's a study that was done that compared Vioxx with white willow, and it turned out that pain relief was the same for low back pain, less side effects with the white willow, and white willow is less expensive.
What are some of the most common conditions where Salizain would be beneficial?
I use Salizain for any of the conditions that are generating pain. I mean, acute lower back pain, acute neck pain, certainly the overuse injuries such as tendonitis, bursitis, they all respond pretty well.
Headaches can as well.
Dr. Antico, in your practice, how do you use Salizain to take the edge off pain?
I typically use Salizain during the initial presentation. Patient presents acutely. We want to go ahead and try to provide something for pain, and we also want to try and control the inflammation. And you know what? People really expect that when they walk into a doctor's office, so it's nice to be able to provide something. The typical recommendation is going to be Xymane, the omega-3 fatty acids, and Salizain. The Xymane and omega-3 are going to take care of inflammation, and the Salizain is going to help reduce pain. I typically recommend one Salizain every 4 hours as needed, up to 4 a day. And we do that for about the first 3 or 4 days, depending on the patient's condition, severity of pain. After that point, we'll reassess the patient's needs and then make additional recommendations.
So that's sort of your baseline protocol?
It is.
Okay. One of the things that we would probably be interested in knowing is an idea of how fast Salizain could work.
Sure. Everyone responds differently, and you certainly have to take into consideration the person's overall state of health. If you have a person that is generally healthy, not significantly overweight, you're going to get a better response. Generally speaking, within the first 2 doses of Salizain, you're going to start to get a nice reduction in pain.
Okay, that's pretty quick.
It's nice.
Dr. Seaman, this question is for you. There's probably a lot of patients out there that probably shouldn't be taking over-the-counter pain medications. Would you agree with that statement? And if so, is Salizain a better choice for those people?
I would agree in terms of long-term, absolutely. So Salizain is much better in that context, because white willow is far fewer side effects compared to NSAIDs and acetaminophen. And interestingly, a study was done looking in terms of side effects. They compared placebo side effects along with white willow, and there were more side effects in the placebo group than the white willow group.
All right. Dr. Antico, in your practice, can you think of one particular case, one case study, where a patient came in, they had acute pain, and in combination with your treatments, they had a very good outcome?
Sure, I could think of several. Recently, one of my weekend warriors came in, a 40-year-old guy who plays softball every Sunday, 1, 2, even 3 games sometimes. He came in on a Monday with acute lower back pain. We initiated our in-office treatments, of course, made the home recommendations, and started him on our acute pain protocol, supplementary. We used the Salizain for pain control, Xymane and the omega-3 for inflammation. And by the time he followed up with me on Wednesday, we had a nice reduction in pain, ranges of motion were up, and by the next Sunday, he was pretty happy to be out there playing again.
That's pretty amazing results.
It was good.
Well, gentlemen, I appreciate your time and insights today on treating pain naturally using Salizain. If you would like to learn more about Salizain and to read additional case studies, please visit us at www.salizain.com. For any questions you may have, please call our technical experts at the number on your screen.